Hello there. My name is Dr. Karuna Satori, and this is our first time meeting, correct? Well, very nice to meet you. Feel free to call me whatever you feel comfortable with. I personally find that calling me by my doctor name gives me a type of superiority that simply is not there. You and I are equal, and I won't play those games. Excuse me while I have a seat. So, with this being our first time meeting, this will also be your intake today. Now, you may notice I am kind of going back and forth with a little bit of whispering and speaking. You have to forgive me. I am getting over a very severe cold, but the only thing you're going to be hearing much from me today is during our intake, but then we are going to move on to our very first session, and I want to let you know that this being your first time here, the first time is not your last time. Whether or not you leave here with your life changed, it is always better to just always come back and check in, but we'll move on to that. So let me just get a little information from you. Okay. I'm going to be taking your blood pressure, your heart rate, heartbeat, and just doing a quick little check of the face with the pin light. Okay, so getting this up. You just introduced yourself, so I'm assuming your last name is... Thank you. Your birthday, please, just for verification. Okay. Your height. That all checks out. And yes, this is your first time here. Now, when I stated earlier that you should come back more than once, trust me, it's not because of the insurance or out-of-pocket cash. Just a little bit of doctor-patient humor. I just try to make everybody here loosen up and feel comfortable to talk. I think that is the most lacking thing in doctors' offices these days, and I'd love to change that stigma. Now, the only time that any medications you may or may not be taking comes into place is whenever we do the mental health wheel, which is the cognitive behavioral therapy identifications, which we will get into after I get some vitals, okay? And that's whether or not you would like to talk about those. So, I'm just going to go ahead and get my stethoscope. I'm going to go ahead and get my stethoscope. Okay, my stethoscope. Good. Okay, so I am going to get a little bit close to you, okay? And I'm just going to put this right on your chest here. And can you go ahead and give me a deep breath in through the nose and out through the mouth. Again, in through the nose and out through the mouth. Very good, thank you. And I'm just going to go ahead and get behind you here. I'm just going to need you to do that one more time. nose and out through the mouth. Okay, and just again, in through the nose and out through the mouth. Very good. So, your heart rate does seem to be a wee bit high. I'm not going to give you exact specifics, and I feel like when the doctor gives me exact specifics, unless it's an emergency, I give myself even more anxiety, and I completely understand with this being your first time that you might be a little on edge, but that's no problem. Just going to get a blood pressure on you soon. Okay. Get out the cuff here. You may catch me tapping on objects for the sound. I just find it very pleasant. Very, very pleasant. Have you ever just stopped and listened to the sound of an object? For example, in the morning time, after I have a nice fresh cup of coffee, I enjoy while driving. I have one of those sticky steering wheel covers, and sometimes I'll just grip safely. But getting a little off topic here. Why don't you do me a favor and just tell me why you're here. Now, it could be because somebody put you here. It could be because you want to be here, but can you tell me a specific problem? If you're feeling comfortable, if you just want to kind of tell me with your head or with your mouth vocally, I would just really like to hear about it. And then we'll start with our session as soon as I do the pin light after this. Okay? Just think about it for a little bit if you don't want to talk. I just want to hear. Just gonna slip this right in this arm. Very good. Set that. Go ahead and put your arm right there. Just going to go ahead and ready? Here we go. Okay, it seems that your blood pressure is normal, although your heart rate was just a little high a few moments ago. But go ahead and think about a serious issue in your life that may be causing your depression and anxiety, okay? Or sadness. Doesn't always have to be depression. Could be anything. I really love those sounds. Okay. And last but not least, do you mind if I just take a look at your eyes? I would just like to see how your pupils react to a little bit of bright light, okay? And the reason I'm doing that is I just want to make sure that potentially potential said issues doesn't have to relate strictly to health. For example, what we're going to be dealing with in our session today is the the mental health wheel. And what that does, it has 4 issues, whether that be actions, thoughts, emotion, and health. And if we start with the issue where your health was, sometimes it's not necessarily the health that caused it. It could be an body issue, maybe high functioning thyroid, things like that. So I'm just gonna see how your pupils react. Okay, I have a little pin light here. Shake it up a little bit. It seems like the battery is dying. So, okay, are you ready? A little bright light here. Start on this eye. Okay, very good. Just stare straight ahead. Right at me. Right into my eyes. Do not follow the light just yet. Very good. Okay. Gonna come in here, straight at me. You're doing good. Okay, keep going. Just straight into my eyes. A little bit awkward, I know, but nothing you have to worry about. Okay, and one more time. Yep, very good. Very, very good. And the other eye. Okay. Just find where you're a little close and far away. Okay. Here we go. Straight at me. Okay. Keep straight in my eyes. Open your eyes. Open your eyes. Very good. Okay. Right at me, okay. Right at me. Very good. Excellent. 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 Okay. Your pupils are reacting fine. So, with that being said, I'm just going to go ahead and take the stethoscope off for comfort. I just want to get comfortable because today we are going to do our very first session of cognitive behavioral therapy. And I have a little chart here to explain a little bit how cognitive behavioral therapy might be able to help you. So, judging by statistics, which I don't always go with because they can be all over the place, cognitive behavioral therapy has been proven to help over 60% of Americans suffering with depression and anxiety. And it's a very simple type of therapy. This, as I've stated twice now, is the mental health wheel. And it has 4 of our main factors, which is the health, thoughts, actions, and emotions. Now, you might see a bunch of arrows going everywhere and letting you know that your health is based off of your emotions, actions, and thoughts. And the 2 easiest ways that we can fix the said issue is by identifying your actions and your thoughts. So, if that's not necessarily the case, we can simply find one of these 4 traits and find a solution. So I'm going to be erasing this entire chart and we're going to remake the chart. And if you could just think while I do said action, I would just like you to present a very big problem of why you're here. Remember the last time you were feeling very, very sad. Close your eyes for a moment. Just get yourself comfortable. You can sit back in the cozy area that you are in. Just close your eyes and see how far back you can think to what started the sadness. Okay? So, our goal today is to identify issues to stop said problem. It's that easy. Consider it a little bit of counseling, consider it a little bit of companionship. Either way, we're going to figure this out and help you deal with it. Okay, so oof, you hear that wind out there? I won't interrupt you. Just present a problem, if you will. This might be a little bit messy, but okay. Very good. Okay. So we have recreated our wheel without arrows or anything messy, and I'm also going to erase the goal for today. Because since this is your first time, I just want it to be about us. I just want this to be comfortable with you and I, and we are going to identify at least one of these today. That doesn't have to be the exact root of said problem, as we're going to do more than one of these sessions. But we're going to focus on the negative wheel as much as you're comfortable talking or thinking about, okay? So, while you finish thinking about that, can I offer you a cup of coffee? I'm going to go ahead and have one myself. Change the cup out of the wooden Keurig. Yeah? Good. Something that has been causing your sadness, for example, may have happened. I can give you an example to help you identify. Okay, well, let's see. About a few months ago, my second job kind of went to heck, and after the sad situation had hurt me, I stopped worrying about my daily life activities. I started sleeping all day. I started eating very poorly compared to the routine I had daily when I was working that job. I stopped calling people that meant anything in my life. I stopped calling them on the phone. I stopped interacting and connecting with them. It was very unfortunate, but after having therapy, I'm going to go ahead and set this down. Start the cup. I identified that the main problem was from a situation at work, and where I started going wrong was from my actions. Actually, it started off with my thoughts. I started thinking, what am I going to do? What is going to happen with all of the extra income that I did have? So we identified the thoughts, then after that became the actions. And then after that, I realized because of my thoughts creating my actions, creating my negative health, it created a lot of negative emotions, and it's just a big wheel, okay? And then we created the positive mental health wheel, which is what we can use to change our behaviors. And by just one step at a time, we can change without all these problems. So let me go ahead, and while that starts to boil and simmer, let's think. So can you think of the situation that you were having lately? Okay, I see. So maybe, may I suggest that because of this situation first, you started doing exactly what I did. So let's go ahead, get the marker, and we're going to start off. Because of the situation, you started having negative thoughts. Okay? And because of those negative thoughts, maybe you went a different route this time other than myself, and your health started deteriorating because all you started to do was think and 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 think. So now that we've identified that the thoughts were the main problem, we've also identified that it might potentially be because of your health. Second, so overthinking caused lack of hydration. You might have started to forgot to drink your water. You might have forgotten to eat one day. And also, maybe that would have started causing some negative emotions. Seeing after thinking that your health, you're starting to get dehydrated, you're not starting to feel very good. Your emotions started to deteriorate, causing a little bit of sadness, and potential depression. Could that be right? And unfortunately, those negative emotions probably led to some bad actions. Can I say that that might be correct as well? Yeah, and that's completely okay. We've already completed and gotten somewhere with one step of our problem. Think about that for a moment. We've identified that the first part of your issue, and even if I am wrong, you can look at this yourself and say to yourself, this situation happened and my actions, I immediately acted out. I got angry and I called up my set person on the phone and snapped out on them. Things like that. You understand where this is going? Good. Very good. So, I'm going to go ahead and get us a cup of coffee, and we can go ahead and erase the board and figure out our first solution to the problem, which I'm really excited about. May I ask, do you take milk and sugar in your coffee? Good. Okay. All I do have is low-fat milk, which I personally like 2%. sugar cube. And here you go. I'll let that settle. Grab myself some coffee. But anyway, it might be, very uncomfortable to speak about this issue, and I completely understand. Unfortunately, I do say to everybody that it is sometimes necessary. People forget that us as humans have emotions too. We have thoughts and we have feelings, and if we just had somebody to listen to us, like you being here with me right now, things would be a lot easier. So once again, you can sit back and relax and enjoy your coffee. We've identified that the main problem here were your thoughts. You can see my nails going through there. Followed by your health, emotions, and actions. So now we're going to redo the chart. And figure out some good things. So health, actions, emotions, I think was on the other side, but yep. I could have let it go, but I'd rather not. Thoughts and emotions. Cross, circle. Good. A very poorly drawn chart. So, why don't we start opposite this time? Why don't we try that route? For example, we identified that your thoughts were the reason for the situation, but we identified last that the actions that stemmed from your thoughts into health, into emotions, didn't cause a very good outcome. So why not do it differently? Fool me once, shame on you. Fool me twice, shame on me. Let's not shame ourselves, and let's think. What's an action that we could start today? Not today. That we can put into our daily life by just one step at a time. And then followed by the actions, we go, I'm gonna do the arrows again. Emotions, health, and then thoughts. And then it cycles. And we can complete what you originally came in here in for the first place. And maybe some other time you'll be coming in here with a different problem, which you understand what I mean. What do you say? I'm going to ask you just one action you can do today to prevent or stop said negative thoughts that has been consistently happening in your situation and daily life. Okay, how about we can try the snapping method, which I could do a very small, just itty bitty, maybe 1 or 2 minutes of it to show you what I mean. So this is a form of hypnosis, and we'll use that as our first step today. And then our next cognitive behavioral therapy session, we can identify, going backwards, an emotion that can be positive rather than negative, followed by next session are health and thoughts. Now we can focus all of them at the same time, but why don't we just simply try action today? And we're going to kind of use our original problem, which were our thoughts, to go ahead, excuse me while I get a little closer, and fix that. So the snapping method, doing it a little bit gentle, is where I use in my other therapies a type of hypnosis. And what you do is, let's say you're having a negative thought in your head. I want you to take out of the worst sentence in this situation, for example. I don't want to get too deep here. Molly got very ill this morning. What do you think the worst word in that sentence was? What gives you kind of anxiety and a little bit of fear from that sentence? Ill, being sick. So what we do is in our head, when we're thinking just naturally, if you feel it coming, if you feel that thought coming, it comes very quickly, we snap. So, figuratively and literally. Okay, so in your head, when you're starting to think that negative thought, the worst thought you can come up with, when it starts to come, start to snap. And in that moment, I want you to start to do something positive no matter where you are. You can start by taking a deep breath, by going, take 3 if you have to, even if you're in the busiest part of work. Nobody needs to know, just snap during the most negative thought that you're hearing, and then start to replace it with something positive. And then after a while, after you're so used to the snapping with the negative emotions, whether you're doing it all day long, that's whenever you stop doing it. Stop the snapping. And then whenever you're starting to breathe, after you have those thoughts, you could be deep breathing all day. And then you start snapping whenever you're deep breathing. And you have officially replaced something negative with something positive, and you've inserted it into your daily life, making it a positive action. Okay? What do you think of that? It's a lot to take in. So, let's just recap what we've learned today. We've started our first session by identifying that the situation that you're thinking about today was in relativity to your thoughts. Your thoughts, in turn, started causing negative health by potentially forgetting to drink, stay hydrated, forgetting to eat, which caused some negative emotions, resulting in some pretty not very good actions. And with that being said, our first cognitive behavioral therapy identification was that we are going to do it opposite. We're going to start with your actions this time, based off of your thoughts being first last time. The action, we have decided that you're going to be doing snapping, and snapping is a form of hypnosis used to treat certain patients, with whether that be with EMDR, eye movement desensitization, and reprocessing therapy. And snapping, you're every time that you're hearing a negative thought, you're gonna snap and then replace it by an action, which is some maybe calm breathing, lighting incense, turning on a song that you love. After you're so used to talking about the negativity or thinking about these negative thoughts and snapping with them, and you feel that it's just so repetitive, you're gonna replace it by snapping when you are doing the action for that thought. Okay? And after so long, you're snapping with the positivity that you've replaced the negative emotion, thought, health, or action. With that being said, I really hope that you benefited from our first cognitive behavioral therapy session today. I personally loved meeting you, and I hope, judging by your feedback up front at the desk or comment down below, how you're feeling. And if you would like to continue this therapy with me, because I feel like you and I can both benefit from this. Okay? So, if you need me, I'm always here. And there's over 300 of me with you right now. But if you really do need me, just remember I'm always here. no worries about anything else. You are safe, and you will get through this. You have a good night. Just sit and relax a bit,